Hello, this is John Kanelopoulos from our center here in Athens, Greece, the LaserVision Ambulatory Surgery Center. It's really a pleasure to share with you the data, and this is a very subject of mine in refractive surgery on the effect that we've seen with using 0.09% topical bromfenac. Its commercial name is Yellox, and I have no financial interest in this particular project and product in managing discomfort following photorefractive keratectomy, our own mini-PRK technique using the ORCA EBK device. And we have a presentation in this meeting looking at the mini-PRK technique on its own. We're going to see here just the effect of bromfenac and how it can make the procedure far more comfortable. These are my financial interests, and I do consult for Alcon, and we'll see using the EX500 excimer laser for our procedures and OptiView further down the line. So in this study, going to our next slide, we investigate the adjunct effect of 0.09% bromfenac. As I mentioned, in Europe is marketed as a commercially available product called Yellox by Bausch & Lomb. In the U.S., the similar but different concentration product is Prolenza, and it does in the U.S. hold approval as an alternative for post-cataract surgery inflammation. So many surgeons in the U.S. use it instead of topical steroids following cataract surgery, and this should say a lot for its efficacy. So we looked randomized 255 cases where we performed a mini-PRK with the X500 excimer laser by Alcon Wavelight, and we used in most cases topography guided customization with topography modified refraction, our technique described over the last 7 years. And some eyes were treated, a small number of eyes, 5 eyes, with the Innovize ray tracing customization. So this only relates to the ablation by the X500 excimer laser. All procedures were similar, as we will see in a little bit, as far as the deepithelialization of the cornea that was performed with the ORCA EBK device, and it was specifically customized to include only the area of the anterior stroma that was going to be ablated. So a lot of back and forth between the excimer to look at the diameter of the treatment plan. If it was myopia, obviously a round diameter of about 6.5 to 7 millimeters. If it was myopic astigmatism, an oval. And accordingly, we customized the deepithelialization with the ORCA device, as we will see shortly in a video. And the only thing that we changed in half of the eyes, and they were randomized, is besides the antibiotic and the antibiotic corticosteroid combination, we added a drop of bromfenac sodium hydrate to be used during the procedure to soak the bandage lens and to be used per need for the first evening of the. We're seeing here some data of a case that we opted to perform PRK. The reason being, as you can see on the top, the epithelial maps by the amazing OptiView anterior segment OCT, placido topography in the middle showing relatively regular astigmatism, but there's some truncation here. And on the bottom, the Pentacam maps show a format of thickness which seems to thin abruptly. And this in an environment where we see so many keratoconus patients, 1 in 20 patients from the population we do cataract surgery has established keratoconus when we look at their topographies. So thus we're careful here due to the thickness and the distribution of the thickness from center to periphery to perform PRK. So as I mentioned, Group A was the bromfenac group. Group B, our routine mini-PRK procedures. We scored pain from 0, no pain at all, to 4, maximum pain. And we looked at adjunct medications such as oral Lonarid or intramuscular paracetamol to be used if needed. So here is the mini-PRK technique. I'm using the ORCA EBK device to manually remove only as much as epithelium needed to fit the ablation and the transition zone. We've, of course, studied this on the X500 excimer laser in order to achieve the exact diameter, and it does take some practice. You can see how I'm orienting my EBK device in all different directions to remove only as much as possible. Very interesting technique, and it'll heal in 3 days. So we saw a brief video of how different this is than the very popularized transepithelial PRK, all the older techniques of removing the dilute alcohol-soaked epithelium. So let's look at the results. Again, this is just an example of ray tracing, and we'll present this in a different results. The mean age was 28 years, so younger patients, 121 cases in the bromfenac group, and there was a dramatically different score pain, 1.5 in the bromfenac, 3.2 in the control group, and we can see how dramatically this changes the first night, mainly comfort level for patients. We saw in our mini-PRK data that these patients see 20-25 after procedure and are far more comfortable than what we're used to with LASIK and SMILE, and certainly far more comfortable than what we're used to with PRK. And I think it's two elements here, the smaller depithelialization and the adjunct use of bromfenac just for the first day. And obviously the difference was statistically significant between the two groups as far as pain, but not as far as the speed of reepithelialization that was almost 3. So these data in summary suggest that our mini-PRK technique, and as I mentioned before, we also have a paper in this meeting underlining the pearls of this technique using the ORCA EBK device in a specialized way that we saw in this video, along with topical bromfenac, can really change the patient experience as far as PRK and make it a relatively comfortable procedure with rapid visual rehabilitation for the first day. There's obviously between day 2 and 3 some reduction in visual acuity and ability to function, and of course it does hold the disadvantage to PRK and PRK rather to LASIK and SMILE that it does in our environment require protection from UV light for at least 6 to 8 weeks, and we do that with sunglasses, cap, and adjunct 1,000 milligrams vitamin C daily. But profile, and we think that these data place the mini-PRK with the adjunct of bromfenac as a superior option potentially to LASIK and SMILE if Sun considers the immediate post-op visual rehabilitation and comfort, the restrictions of avoiding to remove a LASIK flap, for instance, the potential risk of an lamellar procedure, and a very high safety profile with the only precaution, the exposure to UV light for countries in Southern Europe like Greece. I hope you found this presentation interesting. From Athens, Greece, thanks so much for watching.
By K.M. Naderi, who is here in London, as I am, and the presentation is